gonna have Ashley put it on me.
Ashley. What are you doing on the floor?
I think so. Here.
All right, you guys have already seen these images, right?
Christina.
Yeah.
Yeah.
So when we come in for our test in a couple of weeks, what I'll have is little arrows pointing to different areas, and so the morning of the test, I'll have a drape or something over it. You can't go on these view boxes. So I'll have an area and say I'll have something pointed here, and that'll be number 1. What is that? Frontal sinuses. And I might say, what position best demonstrates the frontal sinuses? And that is? PA or PA Caldwell. I would, accept either one of those. Except this isn't either one of those, but you know what I mean. I'll ask what best demonstrates it. And what is this one? Waters. Specifically, it looks like a transoral, right? Open mouth. So you can assume, especially with the collimation, that this is not a skull. It's supposed to be sinuses. Now, you see how they collimated in? They could have even collimated in more, right? Because this person had a pretty tiny skull. They only clipped off a little bit over here, so we could definitely cone in just a little bit more. Okay, so what would we say this image is? Just a PA or whatever, I don't know. I couldn't tell. Actually, I have on there backwards. But I might have something pointing here. What is this area? What is this area? Mastoids. Okay, good. Let's see. What is this in here? Ethmoid. Right. Good. What was this?
On the test, are you going to be specific whether you're talking about a bone or section or something?
As far as this portion or what?
Yeah, because that area you pointed to could be ethmoid or ethmoid sinuses.
No, I probably won't be. You'll just have to tell me. So I would assume if you knew that was the ethmoid, you would know that would be the ethmoid sinuses. Conversely, if you put it was the ethmoid sinuses, I would assume that you would know that's the ethmoid. So they go together,
So if you could.
Yeah, it makes it pretty easy like that. This looks like those turbinates, doesn't it? Looks like they got something going on in there, or they got something packed in there that's opacified, I guess we could say. So what is this one supposed to be?
Waters.
A waters. What did they forget to remove?
The dentures.
Some dentures there. It's not really impacting this image, so I guess it's okay. What sinuses are these? Maxillary.
Frontal.
And how about in between? Ethmoid. What makes up the bony nasal septum?
The perpendicular plate.
Perpendicular plate of the ethmoid and the vomer. Good. Okay, what is this one supposed to be? SMV. And we do see that the mandible is a little bit anterior to these mastoid air cells. However, it's not anterior enough, right? So they need to do what?
Extend the head.
Extend the head back. All right, what is this supposed to be? A mandible, panorex, right? Common dental exams. There's only one place for Walton that has it. Okay, we're not going over mastoids right now. Probably never. What is this supposed to be? SMV for? Okay, so a question might be, now we see, say it's hung correctly, which zygomatic arch would this be?
The left.
The left. And so we're not visualizing the right very well. We can see a little bit. Tell me in writing how you're going to fix that. You're going to do an oblique.
The 15, and then the downside.
Center to the downside. You're going to rotate and tilt your patient's head, right? And center over the downside.
But still be open on the other side, just in case, right?
Well, you can leave the film open. This may or may not still be open. Okay. In your book, it does say center over the downside, but just like SI joints, you guys have done SI joints, right? In the book, they're unilateral, correct? Who's done SI joints? Don't you leave it open to the cassette side or just a little bit collimated in? Because they're looking at both sides, one open, one closed, correct? Same here. One open, one closed. Technically, it's supposed to be unilateral, but most facilities leave it open. Okay, what is this supposed to be?
Lateral sinus.
Probably lateral sinuses. If it was facial bones, they'd probably include a little bit more of the mandible. Which lateral do you think that is?
Right.
It is a right lateral. And what sinuses do you see on that view?
All of them.
Excellent. All right.
Whoa.
Okay, so what do we have here?
Mandible.
Mandible. And according to this image here, they're x-raying which side?
Right.
Right side. What do you see best on this image here? The body. Good, good, good. What is this? Looks like a towns, right? So with the towns, how much angulation and which way? Typically?
30,
37 bottom. What are you supposed to see here?
The dorsum cella, but that
The
was
dorsum cella within the foramen magnum, correct? We don't really see that there, so I'm thinking that this is probably more of a mandible exam, right? For T&Js or mandible, right? Because those are more in the center. They could have definitely collimated. Okay? Does everybody get that?
No.
Okay. So this is a, what do we call it? A town. Now, on all skull work, even the towns, are we supposed to have the entire skull?
Yes.
Do we have the entire skull?
No.
No. Okay, so there's our first clue. It's got a sticker on it, so it was approved. So that's our second clue that it wasn't. The dorsum cella is not in the foramen magnum, but we do see pretty well, what, the condyles here? Of the mandible. So if I had to say, and it should be collimated like that, if I had to say, I would guess that this is more for a mandible. Even though they don't have the mentum here, I would say this is more for a mandible, just because the skull is cut off.
Now, I have a question. Our workbook says that if it is, if the head is overflexed, you'll see the C-spine, 1 and 2, or 1 in there in the
Okay.
view. What if it is too far, under flexed? What would be there? Just nothing? Or?
It looked more like a wonky AP or something, you know? Okay, what is this supposed to be? Who knows what that's supposed to be? I would think it's supposed to be going into a waters, but it's kind of hard to tell. So on something like that, I might ask, first of all, do you think it's a skull, though?
You can see all the...
You can see all the skulls, and they're starting to collimate, but they got...
They accidentally got
That's also kind of funny.
That's in there. So I would say it's not a skull because they have this on there as well.
Well, it looks like they were trying to shoot for the odontoid, but they accidentally got all the skull.
Yeah, yeah, it looks like, yeah, C-spine odontoid, yeah. I don't want any of your C-spine images to look like this. So it could be a modified waters for facial bones, right? So we can go with that, or it could be trying to be a modified waters for sphenoid sinus. It's just not good with any of those. So it must have been, sometimes they'll turn in, you've seen them accept things depending on your patient condition. And if your patient, if you just can't get it and you've had a tech that tries to help you and you guys together can't get it, what's important that you guys need to do? Dictate it. Document it. Was not able to blah. And so that way, at least you've got something on record. You didn't just let it go as it is with no explanation to the radiologist whatsoever. Sometimes patient condition, I'll tell you a true story on me. When I was one of my first jobs, I was working in Milton at the hospital up there, and I had to do C-spines, and it was the bane of my existence. I hated C-spines. And anyway, I did a C-spine, and it looked so bad. It was crappy, and I went into the radiologist. You guys probably met Dr. Barnes, maybe? Love him. Okay. And I was almost in tears because I tried my best. I had it positioned correctly. And he's like, Grace, relax. Sometimes you just can't get it because of the patient. Give me a good history, some rationale. But if I see you do this on a routine basis on otherwise healthy people, you're out of here. But, he assured me that